कुछ अलग ऑप्शन हो रहे हैं।
हेलो। हाँ। अच्छा ठीक है, वो भेज देती हूँ। अच्छा ठीक है, ओके। लास्ट में आया तो वो तो थैंक बोला। ये लगा लो।
Very good morning to one and all present over here. It gives me immense pleasure to welcome you all on behalf of Jabalpur Institute of Nursing Science and Research and Hitkarni Sabha to this international webinar. Speaking about Hitkarni Sabha, it is a leading nationalist conglomerate of Central India in Jabalpur with a unique contribution to the freedom movements and has promoted the moral, social and intellectual interest and well-being of the people by extending literacy and technical knowledge. Hitkarni Sabha is imparting value-based education in the field of law, humanities, education, science, commerce, computer engineering, and nursing. It is now managing 8 colleges, 18 schools, 1 computer center, 1 Satonmat press, enrolling more than 13,000 students and employing more than 1,000 teachers and staff. As we all know that in today's dynamic health system, technology plays an important role, and specifically it needs, has been enhanced substantially in this COVID era. Nursing informatics is a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom in nursing practice. It guides nurses, user, patient, the professional healthcare organization, and other collaborates in their decision making in all performance and ambience to gain an aimed conclusion. As our profession continues to advance, nursing informatics has the potential to change our practice for the better, not only for us as nurses, but also for our patient population. So it seems necessary to talk about the role of nurses and highlight the need for appropriate use of information technology in order to effectively take advantage of information technology in providing quality nursing care and thereby empowering the nurses. In today's webinar, our eminent speakers will be sharing insight on role of nursing in digital era and telenursing and emerging innovation with health sector. I would like to welcome our eminent speakers, Mrs. Sharon Jacob, Nursing Informatics Specialist in Norwalk Hospital, Connecticut, USA. Professor Dr. Geeta Parvanda, Principal, Panna Dhaima Subartri, Nursing College, Meerut, UP. We heartily, both of you, madam, it is a great pleasure for me to introduce our first speaker, Mrs. Sharon Jacob. She has 19 years of experience in healthcare industry with excellent reputation for resolving problems, improving process through information structure, use of technology, and integrating nursing science. She completed her BSc in 2001 from Bhilai, Masters in Nursing in 2014 from Peardale University, Connecticut, USA. She worked as staff in JLNHRC in Bhilai from 2001 to 2002. She worked as clinical instructor in Florence School of Nursing in Bangalore, India from 2002 to 2005. She worked as staff nurse in Norwalk Hospital in Norwalk, Connecticut from 2005 to 2013. She worked as nursing informatics specialist in Norwalk Hospital in Norwalk, Connecticut from 2013 to 2015. She worked as professional practice coordinator in Western Connecticut Health Network in Norwalk, Connecticut from 2015 to 2019. And presently, she is working as director, nursing practice and special project in Waterbury Hospital in Waterbury, Connecticut, USA. She is a recipient of Norwalk Hospital President's Award 2010, recipient of Nightingale Award for Nursing Excellence in 2012, recipient of Dr. Reddy Quality Award, Glycemic Care Team in IT 2015. She is a change agent, innovator, and strategic decision maker. We are so happy to have you with us, madam. Now I would request Madam Mrs. Sharon Jacob to take over the session.
Thank you so much, Dr. Professor Das, Principal Ma'am, for this kind introduction. And hello, everyone. Thank you all for attending this webinar and getting up so early to listen to me. I would like to say special thanks to Jabalpur Institute of Nursing Science and Research, Hitkani Sabha and Principal Ma'am to invite me to this webinar, and also Mrs. Aradhana Dhanyavad for coordinating this with me in spite of the time difference. Like Ms. Dr. Das has told about my introduction, I am an international nurse and I will be presenting the role of nursing in the digital era, the subtopic of nursing informatics. It matters more now than ever. I am really passionate about this topic. This topic is very near and dear to my heart. And my hope is to inspire all of you through my experience, through my professional knowledge, that we can think outside the box and take nursing into a higher level. So for the objectives of this session, we will describe digital health. We would verbalize the scope and aspects of digital health. We will define nursing informatics, and we would explore the role of nursing informatics in digital health era. All of you know that technology has impacted our lives in more ways than we can ever imagine. For you snoozing your alarm this morning, to getting up to watching this webinar, to right now watching me thousands of miles apart from you, this is all due to technology. And it has exponential advancement in the future regarding healthcare. So let's talk, before we talk about nursing informatics, we have to explore a little bit about digital health. You will hear this term a lot. So what is digital health? According to WHO, World Health Organization, the digital health is this big umbrella and it encompasses e-health, artificial intelligence, genomics. So for me, in simple terms, I understand this as, Google. Take Google, like Google is a big umbrella, and underneath you have YouTube, you have Google Scholars, you have your Gmail, and they all do specific things, but they all coincide to a bigger umbrella. There are different aspects of digital health, just like I said, artificial intelligence, cybersecurity, device software. You must have heard a lot about telemedicine during COVID-19. I would like to wish you all the year of the nurse 2020. It sure has been the year of the nurse, and kudos to all the frontline healthcare workers who have done tremendous work during this crisis. And telemedicine, telehealth has evolved a lot during this, but this is not a new concept. But we're now trying to adopt this wireless medical devices. So let's talk about a little bit about healthcare informatics. Nursing informatics is a subset of healthcare informatics. As you can see, there are a lot of different portions of healthcare informatics. And nursing informatics is a very special and holds a huge amount of burden in that. So what is nursing informatics? Like Professor Das said, the nursing informatics is integration of the nursing science, the computer science, and the information science to manage and communicate data. Nursing is science and art, we always know that. Taking that science to the next step and getting to the point where we can actually get the data, create information from the data, and create knowledge. That knowledge could trigger to a wisdom, and we can use that wisdom to advance healthcare. And I will talk a lot about advancement of the healthcare and how we do it. In our next slide, you will see that we have changed. Nursing has changed in the past 2 centuries. We're not anymore a note taker or just going around, but we have become a change agent and innovators in our areas. How did we got here is a big history. You'll be very surprised to know that the first nursing informaticist was Florence Nightingale. Yes, she was the first nursing informatician who collected data during the Crimean War. She collected data to find out the cause of the death for the soldiers, and she created this pie chart. Who would have known the pie chart in 1800s, but she did. Fast forward 100 years later, in 1950s, the computers were invented, and that's where the whole information technology started to come in. The term informatics was first referred in 1970s. It's a French term. It means information. In 1974 was the first time the nursing informatics paper was presented. During 1980s, the invention of internet, it started generating a lot of commotion with other industries. But till this time, healthcare was not up to par with the technology. Other industries such as automation, construction, all those industries were taking the use of technology, but technology in healthcare did not come in United States of America till 2000. And a lot of things has to do by the laws and the regulations from the government. During that time, President Bush and President Obama pushed this healthcare reform and meaningful use to change the healthcare system. And most people know about Obamacare. You must have heard about Obamacare. And forgive me because I will be talking a lot about the healthcare in the United States, just because within the last 15 years, that's where my experience is. But you could relate to a lot of the changes that's happening in India and around the world related to healthcare. So Obamacare, it has changed the way America delivers healthcare. In the simple terms, it is a meaningful use of healthcare technology. It is to improve the quality, safety, efficiency, and reducing the health disparities. The healthcare should be equitable. It should be given to everybody. How to engage your patients and families in their health, improve the care coordination, and improve the population and public health. To ensure there's adequate privacy and security, protecting the personal health information. Just like your financial data, your bank data, your personal health information is as crucial and as important for protection. So this is the pie chart that Florence Nightingale created in 1800s. As you can see, she collected data. And that's what nursing informatics is based on. It is data. This slide will show it better. Nursing informatics takes the clinical and technical language of health and translates them into one. Nursing informatics is the liaison between IT and nursing. Remember, they don't speak the same language, but nursing informatics can transcribe the language from the IT to nursing and the language of nursing to IT. Okay, what the slides really describe is collecting the data. So for example, you are a nurse taking care of a patient who has diabetes mellitus. He's coming to your clinic every month with a high blood sugar, and you're tracking his data. I think there was a disruption in the Zoom. I'm not sure if everybody can hear me.
Okay, ma'am, speak.
Okay.
Okay.
Sorry about the disruption. Technology, right? It could be beneficial, it could be frustrating as well. So about this, the information that collects, how can you create the knowledge so you can promote the health of that patient, give him the right medications, but also see, does the stress increases his blood glucose level? What does he eat? What's his calorie intake is? What's his, and creating that knowledge and provides you with wisdom for providing the best care, not just for that patient, but all the patients who are having this chronic diseases. So taking all the data and creating the knowledge and implementing it for the benefit of the patient's population. Sorry. So why nurses? You would think, why nurses need to go to informatics? And my question would be, why not nurses? Nurses are the biggest healthcare force. In most of the countries, 50% of healthcare force in the world are nurses. Nurses have been rated as the most trusted profession in the United States for the past 18 years. So people really trust nurses. The nurses coordinates care.
Hello. Sorry,
Hello, can you?
ma'am. Please share your screen.
I don't have that. Give me 1 minute.
Okay.
Can you see it now?
Yeah, ma'am.
Okay. I'm sorry. So we were talking about why nurses needs to be in informatics, and my question is, why not nurses? Because nurses are the biggest force in the healthcare. Nurses are the patient advocates. They are the change leaders. And we are the one 24/7 with the patients, coordinating their care with other care disciplines. For some reason, my slides are not working. Sorry. So what do the nurses need to do for their qualifications to become a nursing informaticist? According to Health Information Management System Society, 62% of the nurses who are nursing informatics have a master's degree, and 66% held a postgraduate degree. Now, nurses with bachelor degree can also get certification in nursing informatics and become a nursing informaticist. How I got to be in nursing informatics is I was a staff nurse, and I always got to involve with a lot of projects that had to do with go lives and technology. And a manager from Nursing Informatics asked me if I would like to join their team. And I did not know anything about nursing informatics, but that sounded very cool. And I said I would like to know more about that. And that's how I end up in that position. In the beginning, I have to be honest with you, I did not understand what they were saying, the network, the patch, the servers, and all the technical terms. But then I got in love with this topic and with this subspecialty, and I still am in love with that. So where are they? Where the nurses and nursing informaticians work? They work in all different kind of settings. As you can see, I have friends who are instructors in the colleges. I have vendors, so Apple just there was this position in Apple for nursing informatics, if anybody's interested in that. Companies like Google, Amazon are investing billions of dollars in healthcare technologies just because that's where the future lies. They are in nursing professional organizations, state and national government agencies. And what, according to the HIMSS survey in 2007, 44% of them have been doing system implementation. So system implementation means they are implementing some kind of electronic health record or point of care documentation system. And 41% of them are utilizing or optimizing the system. So once you have the system, you have to optimize it. You cannot just stay there and say, this is it. You have to make it better for the people, for the nurses, for the doctors, and for the clinicians that are using them. So what is the purpose of all this? Why are we doing this? So we have to remember why we all came to nursing. To serve people, to promote health, to be there, to comfort the sick. So that is the whole idea behind nursing informatics too, to promote health, to increase efficiency and increase productivity, to reduce errors. And I can vouch for that with the technology, there is a lot of potential of reducing errors, such as medication errors, wrong patient errors. When you reduce errors, you automatically improve the quality of the care that you provide for the patient, and you keep them safe. That is our goal, to keep our patients safe while they are in our care and to provide a continuity of care. So if they are taking a medication, Lasix, in the hospital, they continue to take that and they understand why they're taking it. When you improve the care, you reduce cost, because you're managing the patients more efficiently. You're providing them the care they need before, not afterwards. So, and the benefits of providing this care in nursing informatics is you have eligible and easily accessible records. I am not sure about you, but there have been so many times that I cannot read what the doctor or the nurse is writing. And sometimes I cannot read my own handwriting, so forgive me. But with electronic medical health record, it is easily readable, it's accessible. All the clinicians, the physical therapists, the respiratory therapist, the occupational therapist, the nurse, the doctor, they're all looking at the same data, the same electronic health records. It increases patient engagement and transparency. So the patient knows that their blood sugar is high. The studies have shown they're more prone of taking care of themselves. They get engaged, they are aware. Gone is the time when the doctor is telling the patient what to do. Patient needs to be accountable for their own health, and they need to be the ownership of their own body. Increase the collaboration between different disciplines. And when you have technology that improves health and improves the patient satisfaction, that your staff is always going to be satisfied, because that's why they became nurses or the doctors or healthcare professionals. So who do you have to deal with? This is a live example of me. When I say me, it's just not me. There's a whole team that works with me. But this is an example that we implemented 2 years ago. We implemented a system called video monitor system for our high-risk fall patients. We have a huge problem of patients coming to the hospitals and having falls and falls with injury. Now, the government said that we will not reimburse you, or insurance will not pay you money for the falls with injuries, because the patient should not get injured while they are coming to the hospital. They should not get central line infections. They should not get catheter associated infection. These are all up to you. And so we had the sitters would sit with the patients, but that cost of the sitters were tremendously high. So we looked into this video monitoring system that it's a monitor, it's a camera, it's a mobile camera that you can put in any room you want. And so the team had to sit with the management, create policies and procedure, who can be on the video monitor and who should not. We have to talk to the vendors, like what is the capability of this system, what can it do, what can it not, the IT security. The IT breach is huge in healthcare technology. There have been incidences where the whole data has been taken and people's data is out there. The hardware, network, the software. Now, a very important role of nursing informaticists is education, the support for the end user, the staff, the nurses, the doctors. They have to know what to do with this monitor that is standing there, what to do when it beeps, what to do if it crashes, and to support the staff nurses. So these are all the examples of our hospitals during my 15 years working in the acute care settings. And there are other fields like community health settings, long-term care, but I will be talking more about acute care settings. So main thing is electronic health record. That is the first thing that you see when a patient comes to the hospital or the clinic, and you ask about all those data, their allergies, their height, weight. There is a lot of benefits for electronic health records. It's a real-time data. It's automated. So you are seeing the data in the real time. When a physician is ordering Lasix, the pharmacist see it right away. The nurses see it right away, as opposed to in paper, somebody have to transcribe it or somebody would have to take it to the pharmacy or get it. But this is a real-time data. There are a lot of things we did on an electronic health record, like clinical alerts. So if a patient comes with allergies of amoxicillin and the doctor is ordering amoxicillin, the system can alert you that, hey doc, this patient is allergic to amoxicillin. Now, we always want to have a system that human factor can oversee or override the alert, so the doctor can override the alert. The same alert goes to the pharmacy because the pharmacy has to verify each medication. And the same alert goes to the nurses when the nurses is administering the medication. Now we can all see that the physician override, the pharmacist override, but these are good systems in place. The sepsis alert. There are some suggested clinical pathways. So for the stroke patients, when they come, there could be clear direction pathways that we provide to the physicians, to the nurses, that we can say that all the stroke patients need to have a swallow evaluation. They all need to have an evaluation by physical therapist or occupational therapist or speech therapist. So we are under regulations and we are doing the right thing for the patients. But a lot of times, and I remember when I was in nursing school, I had to remember all the lab values. And a lot of times you get bombarded with so many data that you forget that, oh, I have to give aspirin to this patient first. But with the electronic health record, there's the ability that it will help you to provide the best care for this patient. Now, I'm not saying that it should take over the care we're providing, but it should always help us to provide the care. It suggests you nursing care plans. So if you have a patient with high risk for falls, it will say that you need to do all this intervention so this patient doesn't fall. You have access to online information right away. So you have access to policies and procedures. If I see a new medication, I could just right click and see what are the side effects of these drugs, and I can provide the education to the patient right away. So there are a lot of benefits to electronic health record, but we have to tailor it to our needs. At the same time, e-prescription, which is an online pharmacy, and I'm sure a lot of people in India are using that. It's easy pickup. It reduces confusion from the patients and the physicians, but it also reduces the usage of the medication, which is a huge issue in the United States of America. The pharmacy and the providers can track the usage of the drugs. The bedside medical device integration. This is my pet peeve, and I have been involved with this from the beginning. Imagine you are an ICU nurse and taking care of COVID-19 patients. You're trying to save the life of this patient. At the same time, he's hooked up with this IV drugs, the vasopressor, the sedatives, the paralytics. He's on ventilator, and you're changing the vent settings. And 2 hours later, the patient is safe, but now nobody knows what medication did you titrate, how much he was getting at this time. But with this medical device integration, you can connect the pump to the medical health record. And for the past 2 years, it's going to pull all the vital signs, all the medication that you titrated, the ventilator settings that you changed, and here you go, your real-time data is right there. Same thing with barcode technologies. We in United States, around 7,000 deaths happens due to linked to medication errors, and it is a national patient safety goals to prevent wrong patient errors. Giving a wrong medication to wrong patient, or taking the blood of the wrong patient, or doing an ECG on a wrong patient. This happens in day-to-day life everywhere. But with barcode technologies, you can prevent those errors. There's a lot of scanning abilities that we can do. Remote cardiac monitor, you can monitor a patient anywhere in the hospital, and except they cannot go to MRI because it has metal. We use telehealth in acute care settings, and we have used that tremendously during COVID-19. There is online access to patient education. So if I know my patient is going for a mastectomy, I can send the education for the pre-op and post-op to the patient. So the patient is prepared before they come to the surgery. What do they need to do pre-op and post-op? And it is very beneficial for the patient, because you are empowering the patient beforehand. These are just some time savings technique that we have done for easy login and one sign-on. We have the devices on your badge that you just tap onto your computer and your computer log on. It doesn't need education or something, but it is really nice, and Nursing Informatics comes to help if there is a go live of stuff like that. Voice to text speech, I teach this to the providers, the physicians. It's Dragon. They can do it on their phone, so they don't have to sit in front of a computer and type all of it. They could just say the whole history and physical and their assessment, their review of system, and it just automatically transcribe in the computer or in their phone, and they can just send it to the patient's chart. It does self-help. Like I said, Nursing Informatics is definitely an educator. She's an expert. The RFID tracking, I'm not sure about the nurses who are at the bedside, but my biggest time I spent was searching for IV pumps. And there are devices that you can track through RFID, and same thing for the infant. When they're born, they have this tracking devices on their ankles, so there is no issue with stealing the babies. And that happens, that hasn't happened in 15 years since I've been here, but I'm sure it would have happened before. There's the real-time charting. Like I said, there's medical devices. These are technology that you can find the veins easily. Specialty beds, so you're protecting your staff as well for their back injuries. Secure text messaging, so I cannot just text a doctor and say, Mary Smith is having chest pain, can you come see? It is against HIPAA, which is a Patient Privacy Act. It has to be secure. And there are a lot of softwares that we use for staffing models. So if you are working in healthcare administration, and if you want to see that, you know, how many staffs you need each shift, who can come, it's all electronically, and it has a lot of beneficial for the staff because they can do their own scheduling. This is an example of a pump that does automatically transmission. So you scan the patient, you scan the pump, you scan the drug, And now the pump is connected to the patient and the drug is connected to the pump. Anything you change in the pump will automatically be charted in your electronic health record. Now, it will be there for the nurse to finally save. The final say is always for the nurse to save, because there must be an error or there could be an issue that you want to rectify before you sign the final charting. And another example of the vital signs, like I said, it automatically transmits, integrate to the electronic health record. It reduces transcription errors, it saves time, and it empowers the nurse to take the ownership of the patient. A little bit about artificial intelligence. I haven't dealt a lot about this, but there is a huge research going on in artificial technologies, intelligence in nursing. You must have heard the news that Japan has invented robotic nursing. We're looking into smart room technologies where you can just, from EMR, if I say this patient needs to have an education about congestive heart failure, it will automatically go to the patient's TV and he would have to see that education. And once the education is done, it will chart in the patient's chart that this patient has seen. The patient can do a lot of more with the TV rather than just watching movies. So that is really neat. This is an example of robotic surgery. This is the robot. His name is Da Vinci. And as you can see, the surgeons, sorry, the surgeons here are in the computer, and the nurses here at the bedside monitoring the patients. We do have nurse anesthetists who are monitoring or giving anesthesia. So a little bit about nursing informatics in population health. So the whole idea about the healthcare is changing the healthcare from sick care to population health, to promote health, to promote well-being, to get to that point the patient is not coming with a stroke. Because if the patient is coming with stroke right now, you had past 10 years to promote or prevent that stroke and promote health. We have to, the whole idea in population health is to make healthcare accessible to people who live in rural areas, to improve the communication of care among different healthcare teams. Here, one patient could go to 10 different doctors, and 10 different doctors could give him 10 different medications. And if they don't talk to each other, if a cardiologist don't talk to his endocrinologist, that he ordered some medication that can impact his glucose level, it can impact the patient's health. So it is very important that interdisciplinary communication, and a lot of times that centerpiece is the nurse. She is the one connecting all the dots so the patient can get the best care, provides support for self-management of healthcare. Like I said, it is a time that the patient take ownership of their own health, and we need to empower them to do that. And with technology, it is possible. We have a lot of tools to empower our patients, like patient portals that can send messages to the doctors. It sends appointment reminders. You can see your labs right away. You can see your radiology results right away. The remote monitors, so the patients can walk 24 hours with the Holter monitor, and we can track what activities have been changed. Virtual appointments. There has been studies going on that with the chronic pain management, the nurses are using virtual reality. I was in a conference, national conference last year, and there was a prize from a big EMR for the nurses innovators. And nurses, I don't know where they were from. I want to say Iowa or somewhere. They got this award for using virtual reality for the patients with post-traumatic stress disorders. How can they help them? And it is very interesting what technology can do in patients with depressions, patients with attention deficit disorders. This is an example of a healthcare app. Employers encourages their employees to use health, to promote health. We have, my husband's company gave him a weighing machine that he can weigh himself, and it sends the data automatically to his health account, and his companies can track the data, that is he doing good, is he not doing good. And he has this running app that when he runs, it sends the data automatically, so he doesn't have to do all this work, and it's very automated. A little bit about, because most of you are students and are in college, and so a little bit about nursing education. There has been a huge, tremendous push for simulation in nursing education. I don't know about you, but the first time I saw a tracheostomy and a stage 4 pressure injury, I was scared. And you know, it will be, we teach the students here how to take care of all this in a simulation lab. So when they go to the real case scenarios, they are less prone to do errors and are more confident. And it is very interesting. It is like real life. You have softwares that you put all the inputs, you input the data, and the patients talk, their heart rate increases, decreases. You can teach, we taught residents, the doctors, advanced cardiac life support through simulation. It was very interesting. But the nurses are innovators, and there are big researches going on, big data, the prediction models. You hear the news in about America that the COVID-19 will go worse or better. Those are all prediction models created by all those data, and there's a lot of prediction models used in nursing research. So that is huge. These are some of the examples of the studies that I was involved in my career. And the first one was we did with, I'm sorry. The first one, we did a study with the company Philips. And we wanted to see how can we find early warning signs for our patients, so they are, you know, they are better taken care of. So these are all the great examples, and there are studies that I would be happy to share with. But there are a lot of good things, but there are limitations and challenges in information technology as well. The huge thing for me is human factor. Sometimes I feel like we are so behind this computer that we are losing that human touch. Our patients complain that, you know, the nurses is always behind the computer. And I feel the human touch is very important. There has to be a human factor, because we're not creating cars. We're dealing with human lives. And so there has to be a balance between the technology and the human factor. Cost is huge. Accessibility, you know, can everybody access it? Information overload. If you just go and type right now abdominal pain and fever, you will get a diagnosis of cancer. If you are just a regular layman, you will be so scared that you're gonna die. How do we educate our patients where to look and what to look for? What is the right data? There is a huge things about information security. What are our opportunities as nursing professional? To understand the database structure, you know, in administrative settings, we can reduce the cost and increase productivity. We can transform our nursing education to include informatics. When I say database, the language, we need to speak the language of information technology. An example of the limitation of the data is I got this blood pressure machine from my mom. As you can see, there is no button to on and off. And I did not realize that it is so technical savvy, but the machine for the technical app is in my phone. And my mom said, I don't want that machine. So I have to buy her this one that is a start and stop data. So you have to know the capabilities of your patients, what they can do, they cannot do, and tailor it to their needs. I have a small video that I would like to share. It is a very inspiring video for me, and I hope it inspires you as well.
So sure we can find the answers? It begins with an idea. Somewhere in the information we have, somewhere in everything we've collected, in everything we learned, covered, is the chance to improve health and healthcare. Sometimes succeeding quickly, sometimes starting over again. Why are we so sure about informatics? Why? Because our work in informatics is developing ways to better understand disease and identify potential cures. From global health to personalized medicine, we know the answers are there. Driving discovery, transforming the way we analyze, design, implement, and evaluate the information and systems behind care. Informatics, changing the way we approach health and healthcare. Informatics, realizing solutions that lead to better care. Informatics, looking at the details to find the outcomes we all deserve. Because that's what matters to us. That's why we are so sure. We are Informatics. We are AIMIA. Discovering health insights. Accelerating healthcare transformation.
This video is from American Medical Information Association, and I love that video. I want to go to the next slide. My hope with this presentation is to inspire all of you to train data, to create knowledge, to use it to advance nursing profession and healthcare. I challenge all of you to think outside the box, think impossible. And if I can be a nursing informatics, so can you be. And you are the future of nursing. So, believe in yourself. And if you have any questions, please reach out to me, and I'd be happy to answer anything that you have. Any thoughts, any concerns, any questions?
Thank you, ma'am, for enlightening us with such an informative session. Now the session is open for question and answer round. I request all the participants, if they have any query or question, they can ask. They can message in question and answer box. Ma'am,
Yes.
there is one question. You had already told us, but question is arise. What qualifications are required to practice nursing informatics?
So for nursing informatics, you can be a bachelor degree, and you have to love technology. That is the basic thing. But you can do certification. So there is certifications for nursing informatics. The master's degree is preferred. Every master's course in the United States of America has nursing informatics as a mandatory course. So you get to learn about, like, I don't have nursing informatics as my master's major, but I learned a lot about informatics in my master's prepare.
Okay, ma'am, thank you. Next question is there. What are the scope of nursing informatics in India?
So I think India, I want to say more people in India have cell phone than anywhere in the world.
Yeah.
Technology is huge in India. and we can tailor the technology to definitely promote health and also to prevent, the preventable diseases. I think nursing informatics has huge scope to reach out to your patients. And I don't think so you just need the smartphones. You can use other technologies as well. I know right now it's very personalized health record, but I think that's where the awareness comes with the patients, talking that talk always to your patients. Smoking cessation, tobacco cessation, vaccination, like all those things that we should never have the preventable disease in 2020. India has the potential to grow, and it has a lot of companies are investing billions of dollars in technology in India because that's where the force is. That's where the marketplace is.
Okay, ma'am. There is one question more. How nursing informatics is more significant in this COVID pandemic era?
So I believe the nursing informatics is very crucial. And I think that's where a lot of things started to boom in this pandemic era. And this is not the only crisis we're gonna get. There are more crises coming in this world. But with nursing informatics, we can use technology to the maximum extent. Can I tell you, I was sick. I was taking care of patients in ICU, just helping out. And I got sick and I thought I had COVID-19. I did not, thank God. But I had a doctor who did telehealth with me. And I have to say, it is very comfortable. But we have to extend beyond telehealth. There are telestethoscope, e-stethoscope that the patient can just put in there and the doctor can listen to the heartbeat or the lung sounds. There are sensors you can put so you know what's the patient's respiration is. For your patients with COPD, like what are their activities? Are they having dyspnea at night or dyspnea when exertion when they're walking? How can you track those and how can you provide them with better care? COVID-19 has opened that door, especially with the insurance, because insurance was not covering telemedicine before. But with COVID-19, everybody's eye has opened. The genie is out of the bottle and it's never going back in. So telemedicine will flourish.
Hello?
Yes, I can hear you.
Can nursing informatics is more reliable to defend medical legal cases in clinical setting?
So that is a good question. Nursing informatics, if you have an eligible medical record, which you can read, yes, you can justify the care you provided. But the documentation is as good as the people who is documenting. So if you turn your patient every 2 hours, but you didn't document it, you cannot defend that the patient did not get pressure or injury because we didn't turn the patient. So we get a lot of cases and we deal with a lot of regulatory compliance with the same thing. The nurses said that, oh, the patient, I did this, but if it's not documented, you cannot defend yourself. Documentation has to be there and that only you can defend. I get pulled to cases with the lawyers and the lawyers ask me 5 years ago and I have to look at the medical record and he say, oh, the patient fell, was there an alarm? And I can only look at the documentation and say, yes, there was an alarm because it's documented. So your protection is only as good as your documentation. And it goes true for all the disciplines, the doctors, the nurses, any therapy, anybody.
Thank you, ma'am.
Thank you so much.
So much. We are so honored that you are with us. Thank you so much.
Thank you. And thank you everybody for listening. I hope I get to inspire you. Thank you for your time. Thank you, Dr. Das.
Thank you, ma'am. Hello, Sharon ma'am. Hello, Sharon madam. Hello.
Hello, ma'am. Can you hear me?
Hello.
Hi, were you trying to call me?
या मैम आप आपका जो शेयरिंग स्क्रीन है ना वो ऑफ कर दीजिए.
Oh, sorry. Okay.
या
Thank you.
ओके मैम, थैंक यू. हेलो. गीता मैम को बोलो आप अनम्यूट करें और स्क्रीन शेयर करें. Our second speaker of the day is Professor Dr. Geeta Parvanda, Principal, Pannadhai Ma Shubhatri Nursing College, Meerut, UP. She did her Bachelor of Nursing from Armed Force Medical College, Pune, Maharashtra. She completed her postgraduate diploma in Health and Hospital Management from IGNOU, Delhi. She did Masters of Science in Community Health Nursing, completed from Rajiv College of Nursing, Hassan, Karnataka, and PhD in Nursing from Faculty of Community Medicine, Swami Vivekanand Shubhatri University. She had received many accolades such as Best Officer Award in Army in 1991, Best Teacher Award, year 2004 from Lions Club Mahanagar, Best Principal Award, year 2007 from TNI UP State, Excellence Education Award from International Institute of Education and Management in 2011, nominated as Chairperson, Nursing Service of TNI UP State in 2012, Best Citizen Award from International Publishing House, New Delhi in 2013, Award for Extraordinary Contribution to the Field of Nursing from IIMH AIMM MS in 2014, Star of Asia Award by Global Achiever Foundation, Kathmandu, Nepal on 2nd August 2014. Nominated as chairperson, Nursing Education of TNI, UP State in 2015. Shushrat Medical Science Award in 2018-19 by Sama Vikas Sansthan, Meerut. Talking about her professional achievements, she has published 20 articles in various national and international journals. She is the author of one book, Short Notes Midwifery. She has presented paper in various national and international conferences, organized 28 national, state level workshop, and one international conference. She has 2 certificates of copyrights from Ministry of Commerce Industries, Department of Industrial Policy and Promotion on Successful Aging Video and Video on Nebulization Procedure on 2019. She been UP Chapter Secretary for SOMI and NGOs. She also acts as a research reviewer in ICM Triennial Congress Bali, Indonesia 2019. We are so honored, Madam, that you are with us. We are delighted to have you with us in today's webinar. I would request Madam Geeta to take over the session. हेलो, जितने भी पार्टिसिपेंट्स हैं, शैरन मैडम से बिकॉज शॉर्टेज ऑफ टाइम क्वेश्चन आंसर नहीं हो सकते थे. अगर आपके मन में कुछ क्वेरी है, कुछ पूछना है, डेफिनेटली आप क्वेश्चन बॉक्स में अपने क्वेश्चंस दे सकते हैं और शैरन मैडम उनका आंसर देंगी और वो आपको आंसर आप तक हम सेंड करेंगे ना, क्योंकि ये एक नया सेशन था. नर्सिंग इंफॉर्मेटिक्स इंडिया में अभी इसका इतना ज़्यादा प्रचलन नहीं है. वी आर डूइंग एवरीथिंग मैनुअली. रोबोटिक सर्जरी अब इंडिया में नहीं है, होगा कहीं जहाँ एडवांस जगह है वहाँ हो सकता है, but everywhere it is not possible in India. So many queries and so many questions I had seen. So definitely we sent these questions to the Sharon ma'am, and she gave their answers, and we sent okay. Hello. Hello, Sharon madam.
Hi, yes, I'm here.
Yeah, there is some questions.
Yes, definitely.
Yeah. Ma'am, there is one question. How can we provide nursing care in a MLC case without physician prescription?
So can you tell me what is MLC?
Medico-legal cases.
Without a prescription?
Yeah, cases without physician prescription. How can we provide nursing care?
So we have to look at our nursing bylaws, like the scope of practice. I'm sure the Indian nursing councils would have, like here the nursing organizations have bylaws and their scope of practice, like what can the nurses do or do not. Like the nurses in emergency room can do a little bit more than the other nurses without orders. But for most of the things, you need an orders. In case of emergencies, yes, like I could check a blood sugar without an order in case of emergency, but I need to get an order later on. Like you could do a CPR without an emergency. You don't need a doctor's order for that. But the medications, you definitely need a doctor's order. You need to work in your scope of practice because that's what's going to protect you in a legal area. I hope that makes sense.
Yeah. Ma'am, there is one question about robotic surgery. Robotic nurses are legally allowed in hospitals nowadays?
So in America, there's only one nurse. Her name is Moxie something. All she does is
Okay.
provide. She does serve she gets the food trays, and especially with the COVID, I think they used, our hospitals don't have it, but some of the hospitals used it. But like in isolation rooms, you're preserving your PPE. So you are taking that Moxie to provide, food, nutrition, the patient needs water, that kind of thing. In one of our sister hospital, we had a couple of different hospitals. They had this company Duracell. They created this machine for them that can provide supplies. She's not a nurse, but she provides supplies from the stock room. So if I need a Foley catheter tray, they could just go there and get it. But I think the scope for nurses, robotic nursing, is a little bit far, because you have to work under your scope of practice, but there are a lot of things that nurses can do that I'm not sure if a robot would be able to do. Like a mandated task or redundancy task, yes, like I'm just thinking like maybe a bed bath or whatever, but like during your bed bath also, you're assessing your patient's skin, you're providing care, you're checking pressure injuries. So where the assessment is needed, you need a really high intelligence, artificial intelligence for that. But it is coming.
Yeah, shortly.
Yes.
Okay. Ma'am, there is one question, because in India, most of the population are in community areas.
Yes.
Nursing informatics also working in community areas?
So it is not as prevalent as in acute care settings in
Yeah.
rural areas. But we do have telehealth in rural areas that we are using, but it needs to advance more. Like I said, technology in United States of America is very new. It's only started in 2000. So there's a lot of work that needs to be done, but it will be there, but not yet. There are some in clinics. There are some in not as much as in long-term care, which here we call like a nursing home.
Yeah. One question, what is its scope in developing and poor condition countries?
So there are a lot of organizations like World Health Organization, other foundations like you must have heard about Gates Foundation, the Bill Gates Foundation. They are doing a lot of work with technology, and this is all pro bono work. Like the countries are not paying, but they are getting with the Gates Foundation. I know they are doing a lot of work in India, in Africa, and a lot of other developing countries to bring, because the ultimate goal is global health. Not one country can succeed if the other countries are not succeeding. So we all have to lift each other, and there is a lot of work going on behind the scene. A lot of organizations, UNICEF and all, are investing. And I understand there's cost is big, especially in developing countries, but at the same time, healthcare is it's not a privilege, it's a necessity. We all need to have healthy citizens, then only a country can succeed and proceed.
Hello. Hello.
Yes.
Yeah. A very good morning. Jai Hind to all. I am audible.
Yes,
Hello.
ma'am. Yeah, ma'am.
Yeah. I'm very sorry for little delay, but I am with full energy. I think now we should start with our topic. Let me first just pray to God in this.
Hello. current situation. Hello, for all the participants, there is some network issues. So after 15 minutes, we are all together. Just after 10 or 15 minutes, we are with, Madam is with us. 10 minutes में